Tuberculosis is bacterial disease. It is caused by bacteria, Mycobacterium tuberculosis. You can see colonies here. Tuberculosis is well-known disease, and many famous people were infected by tuberculosis. For example, George Orwell here and Franz Kafka here. Also, Eleanor Roosevelt was infected by this bacteria. Tuberculosis, also known as white plague historically, or consumption. White plague because people with tuberculosis are more pale and weak. And consumption because people with tuberculosis are severe weight loss. So historically and previously people thought that this disease consumes person's body. That's why it is called as consumption. 23% of world population are infected by this bacteria, and they are latent carriers of this bacteria. It is called latent tuberculosis. If person has latent tuberculosis, he or she don't spread this disease and no symptoms. But anytime it's possible that latent tuberculosis becomes active tuberculosis. And there is around 5 to 10% chance that person who has latent tuberculosis to become it active. And when person has active tuberculosis, he or she is contagious and have symptoms. That's main difference between latent tuberculosis and active tuberculosis. So whole life person can live with latent tuberculosis and he is not spreading disease. He even don't know that he has this disease, no symptoms and nothing, just carrier of the bacteria. And if there is active tuberculosis, it has symptoms, and symptoms are very characteristic. What symptoms? Chronic cough with blood-tinged sputum. It's very important. So bloody cough is very characteristic for tuberculosis. Of course, it can be represented in case of cancers, for example, lung cancer. But many cases when there is blood in the sputum, it can be tuberculosis. Persistent low-grade fever is also a common symptom. Night sweats is symptom, weight loss and fatigue. So chronic cough, more than 3 months. Blood-tinged sputum is important characteristic. Persistent low-grade fever, night sweats, weight loss and fatigue. Now here is question that how easy this disease is spreading. What is duration and closeness of exposure? For example, if family member has tuberculosis, it's very highly that other family members also are infected. In many cases they are latent carriers. But if person have brief contact to other person, in many cases this disease is not spreading like this. So close contact highly increases chance of infection. That's why it's important. Close contact. And what's the analogy? If we say how tuberculosis acts to our body, we can say it looks like undercover spy, which is blending at first and wait for his time, and when time comes he starts action and causes chaos in the city or in republic or in his area. That's tuberculosis. Tuberculosis acts like this because many cases it's latent, but if person has, for example, HIV and immune system is weak, tuberculosis will be active. Now let's say types of tuberculosis. We have two main types. It's pulmonary and extrapulmonary. Pulmonary primarily affects lungs, of course. You can see here also tuberculosis. You can see infiltrate of tuberculosis here also. That's characteristics of tuberculosis. And extrapulmonary forms affects kidneys, bones, and other organs. Now let's say about diagnosis, how we diagnose tuberculosis. Gold standard of diagnosis is culture of Mycobacteria tuberculosis from sputum or other tissues. Also, chest X-ray or CT scan is used. Mantle tuberculin test also used. And what is treatment? First line treatment is several combination of several antibiotics like isoniazid, rifampicin, ethambutanol, pyrazinamide. This combination is used usually 6 months. It's heavy treatment actually. It's difficult and many side effects, but it cures up around 95% and it's really good. We have in this 5% we have treatment resistant tuberculosis, and other different antibiotics are included at this case, and at this case we have around 50% effectivity of resistant tuberculosis cases. Now let's say about prognosis. Mortality rate of tuberculosis is 50% if untreated. I'm saying about active tuberculosis, of course. And global impact. Tuberculosis is still huge challenge for world because it's one of the top 10 cause of death worldwide. It's still important, especially in developing countries. And prevention. We have BCG vaccine, but this vaccine is more effective in children and it avoids severe tuberculosis, but less effective among adults. That's all I wanted to say about tuberculosis. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.